So my name's Julie Bliss. I'm a Senior Nursing Education Advisor here at the Nursing and Midwifery Council. And I'm leading the team looking at the review of nursing and midwifery practice learning. I'm going to let my colleagues introduce themselves. And then what we're going to do is we're going to spend maybe 20-25 minutes just talking through the work that we're doing, what we've done with the discovery work, what we're doing at the moment as part of the next steps, and then we will have the rest of the hour to take any questions that you may have for us. So, Alex, if I could go to you first, please.
Thank you, Julie. I'm delighted to be here. My name is Alex McMahon. I'm the independent chair of the steering group that's been set up. And up until last year, I was the Chief Nursing Officer in Scotland. Thanks, Julie.
You, Jackie.
Good afternoon, everyone. I'm Jackie Williams, Senior Midwifery Advisor at the NMC and leading on the midwifery aspect of this practice learning review, and delighted to see so many colleagues have come to this webinar.
Suma.
Thank you. Good afternoon, everybody. I'm Suma Das, and I'm the Standards Development Specialist, working very closely with the team from a standards perspective. Thank you.
Thank you very much, Suma. If we could have the next slide, please. So we are recording this session, and what we'll do is we'll send the link out afterwards so that you can share it with any colleagues that weren't able to join us. And it will go on to the Nursing and Midwifery Council website as well. Everybody's automatically muted. There is the question and answer feature that you can use to submit any questions that you may have as we go along. But as I've said, we will go to questions for the latter half of this session and looking at that. And you can see the email address there if you're listening on audio only. Thank you. Next slide, please, Suma. So we're really interested in looking at the quality of practice learning, and some of you may have joined us for the webinar that we did in September last year or have watched it on the website. Just as a sort of reminder, as you know, we are responsible at the Nursing and Midwifery Council for setting the education standards. And we want to be sure that these standards are supporting the student journey so that students are able to, and some of you may be students on the call, so that you're able to meet the standards of proficiently and join the workforce as a registered nurse, midwife or nursing associate in order to be able to make a contribution and develop careers. We set the education standards, but we also quality assure. So our education quality assurance framework is used to approve programmes, and programmes are also monitored to make sure that they're in line with the standards. And this is really important because we want to make sure that we're able to maintain the integrity of the register by making sure that when students join the register, they have met all the required knowledge and skills and the proficiencies of the standards. And that's really important. And that's important for the students when they register to know that they're safe and competent practitioners, as well as for the rest of us. Next slide, please, Suma. So we wanted to look at this because, as you know, the public safety is central to our education standards, and students, whatever programme they're on, whether it's nursing or midwifery or nursing associate, whether it's direct entry or apprenticeship, will all be in contact with people throughout their education. So it's important that when the students are in practice learning, they are supported and are able to be safe and learning. But that's also important not only for the public that are receiving healthcare, but also for the practitioners who are supporting the students. That may be practice supervisors and practice assessors, but the whole multidisciplinary team. The other thing that we want to think about is how can we support students on their programmes and registrants early in their career to stay in nursing and midwifery and the nursing associate role. And we know that there are real challenges in health and social care delivery. If we think about the RCN corridor care report that came out earlier in the year, for example, Students are having 50% of their programme is practice learning, working within these challenging environments with practice supervisors and practice assessors who are supporting their learning as we're taking it forward. And that's really important. And we know that the future workforce will continue to require nurses, midwives and nursing associates. And that's working across the NHS, working in social care, working in the community, working in hospital settings, but also working in the independent sector, the voluntary sector, and of course, general practice as well. So I'm going to hand over to Alex now to talk about the next couple of slides. Thank you. Thanks, Alex.
Thank you, Julie. One of the things that's really important about this piece of work, just given the significance of it, is that we have a very fulsome participation process involving all stakeholders, as Julie's just said, regardless of where people might work in either health or social care, with a real emphasis on the transparency around the work itself. So opportunities like that this afternoon, so that people can hear what we're doing and give questions, give comments, and just really play in generally to the work and the processes going forward. The real emphasis here is on co-design and co-production. I know those are words that we often hear, but we've really tried and are trying and will continue to try to ensure that anything that we do is doing with, not doing to. So that principle is hugely important. So the evidence that we hear and the information that we hear from people firsthand really does play an important role in shaping our thinking and hopefully shaping the results at the end of the process. If we could go on to the next slide, please. And just building on that element of process, there was a number of pieces of work that were commissioned during 2024 that have been really important to this process, and indeed giving now the evidence we need or confirming what we thought. But that work also builds on work that had been previously commissioned prior to 2024 as well. So we didn't just start last year looking at this. A really important piece of review was that of simulated practice learning for student nurses, and also an education quality assurance review that was undertaken. And another significant piece of work was that commissioned from Nuffield and the Florence Nightingale Foundation, which was an independent rapid review as well. And as you can see there on the slide, there are hundreds of pages of information that we've been able to gather, providing really hard, solid evidence, or really giving us international literature reviews of what other countries are doing in relation to how we educate, train our student nurses and midwives and nurse associates across the UK. And as part of the process, there's a number of groups that have been established, one of which is the steering group, which I chair, but we also use the NMC Public Voice Forum, as well as a practice learning student advisory group and a practice learning public advisory group as well. And they've been hugely important working with us through this process as well. And I'm going to hand over now to Jackie, if that's okay.
Thank you, Alex. So one of the themes that we are particularly wanting to look at in more detail is around equality, diversity, inclusion, because this appeared to be a consistent challenge within the Nuffield report and right across all the practice learning experiences. And one of the things that we are of note is that we want to think about what is actually happening before the placement actually commences, such as a failure to adopt reasonable adjustments. What happens during placements? Unfortunately, we heard during the placement that some students were experiencing bias and discrimination. And of course, after placements, and what this means on representation across diverse groups when nurses and midwives become registered, and what that means for employment. This is particularly important across nurses, midwives and nursing associate, and these factors are often in relation to their race, their ethnicity, their disability, as well as their socio-demographic status. Next slide, please, Suma. I think the other thing that came out very loud and clear from the Nuffield report is that there was variance in the student learning practice experience. And this was for multiple reasons. In some instances, it was because standards have been misinterpreted. In other ways, standards were being implemented differently. There was obviously the shifting context in health and social care. And we heard a lot about how practice is adopting a more taskification approach to care rather than the holistic nature. And we also heard variance dependent on who the practice supervisor was or who the practice assessor was. Thank you. Suma? So we asked council in January and they approved that we had 5 key lines of inquiry. And although they're presented as 5, we call them Chloe's key lines of inquiry, there is a lot of interdependency across them. And it's going to be very important how the NMC team actually work to ensure that our feedback from our stakeholders goes across the key lines, because they can't be independent of each other. So Chloe 1 is related to the practice learning experiences of students with protected characteristics, including the requirements for reasonable adjustments and the relations this might have to retention. And our definition of reasonable adjustments is quite broad. We're not just thinking about those reasonable adjustments which need to be put in place for those with disability, but a whole range of other reasonable adjustments that might be put in place, both short and longer term. Chloe 2, we want to look at strengthening our approach to supporting students in practice through our standards of supervision of assessment. And these also must include strengthening requirements for protected learning time for our nursing associate students. Chloe 3 is around our educational quality assurance remit and developing quality matrix in order to think about what the quality indicators are for practice learning and their relationship to student experience and attaining of proficiency standards. Chloe 5 is that we want to evaluate key aspects of the midwifery curricula to understand midwifery student practice learning experiences that support student attainment of proficiency standards. And within that, we will be looking at those numerical achievements for that midwifery students have to meet, which would include number of births. And Chloe 5, we want to evaluate the key aspects of the nursing curricula that support nursing students' attainment of their proficiency standards for their intended field of nursing. So 5 key lines of inquiry, but all interdependent. Thank you, Suma. We need to think about the evidence that we use, and evidence again is in its broader sense, not just research evidence, but it also needs to be thinking about the legal framework in which we operate. We need to think about policy, what's happening in healthcare currently, very much reliant on stakeholder feedback, bringing their experiences, as well as thinking about the standards that we have in place at the moment. Thank you, Suma. And I think I'm handing back to Julie.
Thank you, Jackie. Just a couple of things to add before we move on to giving you an opportunity to ask questions. And that is to say that we are very much focusing on practice learning. So the review of practice learning is looking, as Jackie's highlighted, we're looking at the quality metrics, for example, and quality indicators, because it's important that we know that the practice learning is a good learning experience and students are able to meet the requirements, the proficiencies, etc. But I just wanted to clarify that we are only looking at the standards that are related to practice learning. So we are looking at those where they are within the standards framework for nursing and midwifery education, the standards for student supervision and assessment and the programme standards for nursing, midwifery and nursing associates. We're not looking at the proficiency standards for this piece of work. The other thing, of course, is that the standards framework for nursing and midwifery education is very clear. It sets out that curricular programmes should be developed in partnership between universities, practice learning partners, students and the public. So there may be some variation in the way programmes are delivered. It's the unwarranted variation that we are interested in. The requirements for Durham compared to the requirements for Cardiff and a little village in Cornwall or on the Shetland Islands may be different. So that's okay. But what's important is that all students, whether they're doing nursing midwifery or nursing associate, meet the proficiencies and the other requirements when they go onto the register. And that's really important. So we've got an opportunity now for you to ask us questions. I've put some links in the chat for you. I've put the community of interest link in the chat, and also the link for our webpage is looking at the practice learning review and the Nuffield Trust report. But we will now take your questions from the group, all 440 of you, and which is really exciting. Suma, do you want to add something?
I'm ready to share a question.
Fabulous. This is why we have skill mix, isn't it? Thank you.
So I'm going to go straight into it, and I'm going to read out the question first of all, and then we can hand over to you all to answer. So this is a nursing focused question. How can we ensure students are ready for the reality of practice? Employers are concerned that there's a growing number of students that they're stating that they cannot do or work shifts, particularly at the weekends, due to childcare issues, and are concerned that students are coming in with an unrealistic expectations. That's a nice, easy one to start with.
Yes, I was just thinking that myself. Thank you for that. That's really helpful. So I think the things that the thing to think about is that we are interested in reasonable adjustments for key line of inquiry 1, and we know that reasonable adjustments under the legislation are in relation to disability, but we're also thinking about adjustments that might be made and what is possible, and I can see that there are some comments in the chat about reasonable adjustments as well, and I think this is something that we will be exploring in our key lines of inquiry. There are, I think, some challenges for students around studying full time. And of course, these will vary across the 4 countries because things are done slightly differently with funding and various other arrangements. But I think we need to look at what is possible and what can be accommodated by universities and practice learning partners in relation to that. But the students do have to meet the proficiencies, they do have to meet the standards and the assessments that are required for the programme. So I think it's that balance. In some ways, and this is a personal view, but I think in some ways, once you're on the register, you have that flexibility to choose where you work. But students need to be able to meet all of the standards in order to go on to the register. So I don't think I've answered your question. Other than to say that we are really looking at this because this is a really important factor. And as Jackie said when she was presenting, it's something that has come out in the research that's been done in previous work. Alex or Jackie, do you want to add anything to that response?
I think
Jackie, you go.
I think the one thing, as I said earlier, was, it's thinking about short and long-term adjustments, because there is a difference. I think this needs to be, obviously, the universities do have, with having had that clear conversation and that development of those lines with their practice learning partners, to actually share that before students come on the programme. And of course, we know that practice educators do have a huge task to make sure there is throughput of students so that there's not too many students on shift at any one time or at various points in the year. So all of that has to be sort of taken into account, as well as obviously students knowing that they do have, particularly in midwifery, do have to experience the full range of working patterns of midwives. So absolutely something that we want to hear from you. And interestingly, it is childcare that does come up quite a lot, doesn't it, Julie? Over to you, Alex.
Yeah, I mean, just building on what both Julie and Jackie have said, I mean, this is a kind of two-way process, because reasonable adjustments need to be made by all parties in relation to this. And I think there is something about the selection process when undergraduates are coming into the university programmes, understanding the nature of not just the programme itself, but actually what placements mean and where you might be on placement, and actually really helpful, clear, robust discussions at the start to try and accommodate, because there's a few questions in the chat I can see around placements themselves and where you can get placed and can't get placed. And again, I think that is a huge issue itself, given the number of students we've got, and trying to make sure people get really good experience. And to some degree, it takes us back to what Julie said earlier around the kind of quality indicators about how do we ensure that all students are getting a good practice placement and indeed good practice learning as well. But in terms of the adjustments bit, that is so broad and actually that is multifactorial. And there does need to be a clear definition of what do we mean by that. But just as Julie said as well, there might be some subtle nuances depending on where you are in the country, and in terms of where you can be placed and what you can actually undertake depending on that area of placement as well. So there might be subtle nuances in this, but there's a kind of core definitional bit that I think it would be good for us to pin down on. But thank you.
And Alex, just to come back, I think somebody was in the chat, there's quite a few comments now, so I can't find it, was talking about that it's up to the AEIs. No, this has to be a partnership approach.
Yes.
As to what is seen as reasonable, and indeed what practice learning partners can facilitate for all the reasons that we've mentioned, particularly, allocation of practice supervisors and whatever. And interestingly, we have heard a lot about the lack of continuity with practice supervision, which is something that students can find challenging, albeit they can recognise the value of working with different practice supervisors. But the more adjustments that have to be made, that sort of interferes with that as well. So it absolutely has to be a partnership approach.
And I would agree completely with that. This only works if everybody's working together to ensure that we can give the best placement experience. There's definitely something in this around communication and leadership and behaviour as well. I can see one comment there around night shifts. I mean, this comes up quite often. I mean, I think that takes me back to the point is when you come into an undergraduate nursing midwifery programme, there's a reasonable expectation that you would do different shifts at different times during your undergraduate programme. And that does mean there might be a requirement to do some night shifts as part of your experience. So it'd be really strange, to be quite candid, to go through a 3 or 4 year programme without having done at least one episode of night shift somewhere, because it is quite a different environment from day shift, for example. And even though you might not want to work night shift when you qualify, the service requires people to rotate quite often around it as well. So that reasonable adjustment bit, that's where it comes back to the point about, there is something in there that, although it might be challenging for everybody, to try and at least experience it, I think would be really important for students in that. But I think what I can see in the chat though is that thing about who tells who what, and sometimes we've heard there's a kind of distillation of that. There's a bit of Chinese whispers around some of that, or some of it's more about accommodating your particular area because they're a bit stretched, etc. And that kind of brings in Jackie's point about taskification and stuff. So there's definitely some communication type elements in there as well that we do need to work through. Suma, you've got your hand up.
Julie, you're on mute.
Sorry, I'm talking to you all. I really am. I was just saying I can see Gorinda has asked you to put your questions in the Q&A so that we don't lose them. So thank you for that, Suma.
Yeah, I was going to say that as well, because it's very difficult to manage both the chat box and the Q&A box at the same time. So one place, that'd be great. And for the questions that are already in the chat box, we will definitely have a record of that, and we will use that for our work. But one of the many questions that have been in the chat box, just as a summary, has been about the definition of reasonable adjustments and adjustments. And as you know, Julie, I'm quite passionate about being very clear about the language, about what's a legal requirement and what is essentially an adjustment that is established through a partnership between the student and the practice provider and the AEI. So just wanted to bring you in, Julie, in particular, about that, making that clear distinction between what the legal requirement of the term reasonable adjustments and establishing an adjustment for somebody at a time.
Yeah, so the legislation, God, spit it out, girl, is very clear that reasonable adjustments are around disabilities, but also thinking about other adjustments that we might make. So if we take, for example, the nursing standards, and there will be something similar in the midwifery and nursing associate standards. But if we think about the nursing standards, it talks about in their programme standards about taking into account students' individual needs and personal circumstances when allocating their practice learning, including making reasonable adjustments for students with disabilities. And I think you're right. I know somebody's put in the chat about the importance of clarity and consistency, and I think that's really important to think about that, and it's a conversation that we've had several times. The practice learning review, the 5 key lines of inquiry, we're looking at a whole range of things around practice learning. There is a lot of interest in the reasonable adjustments, and rightly so. But we're also looking at the standards for student supervision and assessment and how we can support students and practice supervisors and practice assessors. Let's not forget that, as well as looking at the quality indicators to further enhance our education quality assurance work and looking at the various curricula. Thanks, Suma.
Julie, just a quick request from the Q&A, just to take the slides down while we're not using them so they can see us better.
And Julie, if I could bring in, we have lots of questions, so there's no short of questions, which is fantastic. But I'm also conscious that we've got Albert, who's been patiently waiting. So if you're open to taking direct questions, I'll bring in Albert to ask a question to the panel.
Albert, I think you might still be on mute. Oh, actually, I think you might all be on mute, mightn't you? Yeah. Grinda, is that right?
Yeah. I have manually unmuted Albert, and he can now speak.
Okay.
Thank you.
Yeah. The quick point I want to make in regards to this issue is that I think okay to talk about what is legally reasonable, but I would like to suggest that we think about, first of all, prioritizing what the service needs to be done to ensure that it is delivered safely, and then work backwards from there. And then when you prioritize the services needs for safe delivery, then you see where those adjustments can be made that will maintain the safety, at the same time enabling the students to learn quality skills and knowledge. So I would rather go from that angle rather than get bogged down with the legality, because the priority should be what sort of service is required and how safely can it be delivered. Now, looking at that, is there any adjustment that can be made safely for the delivery to be successful, and at the same time for the student to gain the required skilled learning? That's what I want to suggest, that we concentrate on that. And if that can be framed in such a statement that will help both our clinical partners and the university, so that we operate within that framework, then that should solve a great proportion of the problem. That's my thinking.
Thank you, Albert. It's a really important point, and you'll remember I talked earlier about programmes being developed by practice learning partners and universities and the public and students. And when you look at the programme standards, the standard that I read out, 3.5, it talks about that being universities and practice learning partners need to do that. So no kind of adjustment can be accommodated without it being discussed with the practice learning partner and the university, and that's really important. I think the other thing is, of course, that it's the students' information to share. It's not for the university to tell practice automatically, but there is so much to the review that we're wanting to look at, but that's a really important point, well made. Thank you. I suppose the other thing I would say, and I know that Suma's got a long list of questions for us, but we're very mindful that as the regulator, there are some things that are not within our gift to do, but where they come up, we will hopefully be able to note them and talk to different organisations and groupings, etc., as part of the work that we do around support and influence. So all things are being explored and taken on board, but not all things will be something that we as the regulator are able to action. Thank you. Suma, I'm sure there are more questions.
Oh, there's lots more questions, and I'm just going to randomly just ask. And so completely changing the subject ever so slightly, we're now going to ask a question around SSSA and its application. So there's obviously we've heard ourselves as well about the interpretation of the SSSA standards, and also in particularly about different models. We've been asked a question whether there's a way of having a standardized model and approach. And yes, so if there's any comments that anybody would like to say on that. But before I do hand over, I just want to say that our standards that we have developed, they are outcome focused. And so as a regulator, we're very much looking not here to prescribe a model, where we set a framework, and which is what the standards provide you with, that framework to establish a model for supervision and assessment that's applicable and suitable for your partners, as well as the students who are going to be on that programme. Now that I've said my bit, I'm going to hand over to Julie and Alex and Jackie for any comments.
I'm going to start, if I may. So I think it's a really good question. I think, again, I don't think we want to be prescriptive, because actually it very much depends on the learning environment and what's happening, whether it's general practice, whether it's theatres or a forensic unit. You know, we need to look at that breadth. And we also know, and I know that somebody noted it earlier, that NHSWTE have done some work around the safer learning environment. We know that in Scotland there's been some work done by the task force looking at pre-registration programmes, etc. So we want to bring all of that in. For me, and I was, before coming here, I was working in a university. I think the standards for student supervision and assessment are in some ways very liberating. They give a lot of flexibility to be able to support students across the multidisciplinary team, as well as with nursing and midwifery staff. Now, that's not to say the fact that the practice supervisor can be any registered health or social care professional, for example, is really helpful. One of the things that we are hoping to do as part of our key lines of inquiry, our plan is to go out with a survey. So if you haven't signed up for the community of interest, please do, because we'll be sending it out to the community of interest as well as others, to look at how things are working and how people are supporting practice learning, because it may be that there are some innovative models that could be shared in relation to that. But Jackie, I think you'll want to add something from a midwifery perspective in relation to the way it's working for midwifery students.
Yes, and I think somebody in the chat actually mentioned how this actually all this work interacts in with the student learning charter and the also those principles for SSA. And we, of course, were part of that work. And that's really to support the standards which are outcome focused, but have some more higher level principles for England now about what is a good learning environment, as well as the sort of details around SSA. And I think colleagues on the call should find those really, really helpful, because they're not, again, prescriptive, but they almost have some overarching principles of good practice, which I think because I think it's very difficult to be prescriptive when we think about the range of experiences that students have. And there was another question in the chat which asked about what students are able to do and not do in different parts of the programme. Well, again, that would be variable because it would depend on how the programmes are being delivered locally. So, for example, I know in nursing, there are some programmes when students don't even go out into practice for the first year. So it goes back for me to be really working in partnership with local providers, so that 50% of the programme is in practice. So you have to be working closely with your AEI to work through some of these things of their particular programme. And if I just make a midwifery comment really around SSA, I think I've heard that an awful lot around midwifery students really wanting that, not totally the only practice supervisor, practice assessor to be working with, appreciating the range, but having some system so that they actually do get some continuity, because I think it is becoming more challenging for practice supervisors to sign off proficiencies when they don't work regularly with students, and students feel this confidence building really comes from having more of a smaller team of people who are actually looking after them. Hopefully that answered the question, Suma.
Yes, it did. Thank you. Thanks. Alex, did you want to come in and add any comments? No, I've just put up the slide. Thank you, Gorinda, for the Chloes, and just as a recap of all the areas that we're going to be covering in the five Chloes. If I could now jump to a question. So this is a nursing related question, and it's about whether we are considering the kind of challenges that some fields, particularly as an example, mental health, about students achieving the kind of appropriate skills and procedures. And if I could bring you in, Julie, particularly around Chloe 5 and about the intended field of nursing. And Chloe, if you could expand on that.
Yes, thanks, Suma. So we are looking at fields of nursing, and thanks for putting the key lines of inquiry back up for people to see. We are looking at the field of nursing because we know that there's been some concerns raised around that. I think it's really important to acknowledge that the standards are holistic. I know that some people feel that they may be perhaps a little adult heavy. And I know that somewhere in the chat there was a question around a comment around the Annex B skills. I think in some ways the annexes have perhaps led to some of this taskification, and I'm not entirely sure that everybody who's in adult nursing is happy with the idea of a list. But we're focusing on the practice learning. We will be looking at fields of nursing and how they are being supported to be developed in taking that forward. So it'd be really interesting to see what comes out of that work in relation to that. Alex.
Thanks, Julie. So this is a question that has come up at various points, particularly in relation to the mental health programme. But I guess what this has flagged to us is that some elements of the work that we're undertaking and the things that need to be changed are not necessarily for the NMC itself. because some of this could actually be done by the universities and the trusts or the boards in relation to that balance of programmes and that balance of placements, etc. So it is an issue, but other people, stakeholders, might be responsible, for example, in how that might get taken forward. Because certainly within the mental health one, we've heard about the kind of imbalance potentially around the psychological versus the physical element. But as Julie's just said, those standards are there, and they're there, but actually the delivery of them and how they're delivered is very much at a local level. We are interested in that quality assurance piece, that we can come back at some points and monitor to assure ourselves that the quality of the practice learning and the experience is good. But as I've said, some of these issues could be addressed by others as part of this process. Thanks, Suma.
If I just pick up on that, Suma, thanks, Alex. That's a really important reminder, and that's why we're wanting to look at how the programmes are set out. How are the nursing curricula set out? When do students go out into placements? Where do they go? What are they doing? So we'll be exploring all of those things, because I think it does make a difference, potentially. And it might be a case of being able to share some examples of good practice in relation to that. And of course, you can see that the 5 key lines of inquiry are very much interlinked with one another, and all of these will keep coming back to the quality indicators and the education quality assurance framework. Thanks, Suma.
Thank you. If I could come in, there's a number of questions that we've had specifically about practice assessors and practice supervisors and their skills and knowledge. And I know that as the key lines of inquiry, we don't have a specific key line of inquiry that addresses that. But we have been asked through a number of questions about the knowledge and skills required for practice assessors and practice supervisors, and also how would one keep up to date as well. So if I could hand that back to you.
Thanks, Suma. I mean, for me, that's very much at the core of Key Line of Inquiry 2, looking at supporting students and the standards for student supervision and assessment. We may not have explicitly said practice supervisors and practice assessors, but they're at the core of the standards for student supervision and assessment. At the moment, for the key lines of inquiry, we're doing the desktop research. So we're looking at the Nuffield Trust report, we're looking at various other things and the evidence that we have. For example, we know we do annual monitoring of programmes, so we're able to look at that as well. And that's definitely something that's coming up in the discussions. So at the moment, everything's on the table. We're at the start of this journey. We are doing these key lines of inquiry so that we can identify recommendations that we will take back to Council in November. That's the plan as it stands currently. So we don't have any answers. It wouldn't be co-production if that was the way we were going, and that would clearly not be right. So we are going to be looking at all of those things and thinking about how we can take that forward. I mean, one of the things that's come up is, for example, thinking about the ability to support students who need reasonable adjustments, and what do we do? How do we support practice supervisors and practice assessors in relation to that as well? I don't know if anybody else wants to add anything to that response. No.
Julie, I think the only thing I was going to comment on, I was just reading some of the queries in the Q&A, and about having some sort of standardised approach to practice supervision. I think it's highly unlikely we would go back to stipulating what was required. Although, having said that, in part 1, it's very clear really about what is actually needed to support practice learning. So it's thinking, isn't it, about absolutely practice supervisors need to be prepared for the curricula that they are delivering. So that has to come from the AEIs, and particularly when there's updates, the documentation and all that sort of thing. But then there is some more individualized support that's needed, perhaps, where they've had students and perhaps they've felt quite ill-equipped to support them, and then that particular support and training can then go on. So I think it has to be very variable and has to be sort of very context specific, depending on the sort of the students that perhaps are studying at those universities. But there's no doubt that practice supervisors and practice assessors must be prepared for their role and need to be updated as well periodically.
Yeah, I think that's a really helpful summary, Jackie. Thank you.
If it's okay if I can come in, we've had a number of questions around hours, and I don't want us to feel that we're ignoring those questions. So I want to acknowledge that we have seen all the questions about the hours, and I've just wondered if the panel could say, as part of this part of the project, where does the hours discussion fit into this?
I'll start with that one. So I think we are looking, so council agreed in January 23 that we would look at practice learning hours, but in fact we are looking at the quality of practice learning. We're looking at everything related to practice learning, because I think everybody knows that you can have a 2-week placement experience that's fantastic, or you could have a 6-week placement that was, not quite so good. So we want to look at the whole picture. We want to look at the at what we might be able to use as quality indicators and quality metrics. One of the things that's been really clear in the discovery work is that we can't use quantity as a proxy for quality. And that's been very clear. So we are looking at all of these things. And as I said earlier, I think, at the moment, everything is on the table. So we will be looking at that and seeing how we can take it forward. So we're very mindful of the hours in relation to that. So yes. So I don't have an answer, but we are sort of working on that as we take it forward. Jackie or Alex, do you want to add anything to that?
All I would say is that the point that Julie made is really important, that it's about the quality of the experience, the placement itself. I think the hours is almost a bit of a red herring, to be honest, that number, because there is probably no magical number. It's very much so that's where the quality assurance bit is really important, to understand that wherever you are in the country, your quality of experience that you're having is equal, even with local nuances round about it. Because it's actually the experience itself that has the impact on the student as to whether or not they feel that they're getting a good experience and indeed want to stay in the programme or not. It's not necessarily the hours. So it's one of those, it's an interesting question, but it's maybe not the core question that people think it actually is. But that's just my opinion at this point in the process.
Thank you, Alex.
Oh, sorry, Julie, I just wanted to pick up that somebody wanted to raise the issue about the take a break and us looking at those hours and simulation hours, and all of that is going to need to be looked at. And I think just to reassure people, if there are any changes, we would communicate. We're on a journey now, and it will have to, if there are any changes, it will have to lead to a public consultation. So AEIs and practice partners will absolutely get a lead time if there is any position, and particularly on that take a break. And the other thing I just wanted to pick up about, there was a question around practice assessors, practice supervisors. We're not looking essentially at changing the model, but we're looking more to strengthen, the standards throughout, and that could be across the suite of standards, as opposed to changing the model per se.
And just to follow up on Jackie's point, and there is also the possibility that standards themselves may not change, but there will be supporting information and guidance to better understand the intention of the standards, and with the standards being outcome focused, that will continue, but it's about the understanding of it and then the interpretation and then application of it, which is what we're trying to better understand in this process. So if I could, just conscious of the time, and we won't be bringing anybody on the mic now. So if you have any questions, please add them to the Q&A box. At least then we have a record of those questions. I'm going to now just slightly switch the topic to quality assurance. And so there's one particular question that I'd like to read out. How does the NMC ensure NMC programs assure the same level of governance, practice learning opportunities? Often students who are failing will not complete their placement to avoid assessment. The PLE is then recorded as an incomplete instead of a fail. The student can then continue to repeat the PLE at a number of times. HEIs appear to vary regarding the percentage of time deemed appropriate to assess. Consistency regarding this would be helpful and would ensure we are not failing to fail, and which we've heard this term before. So I just wanted to have this little bit of time on around quality assurance of those programs. So if I could start with Julie and then bring in Alex and Jackie. Thank you.
Thanks, Seema. It's a really interesting question. I mean, it is about how the standards are operationalised, isn't it? But the Education Quality Assurance Framework does look at the annual monitoring, the annual self-report and various other mechanisms to look at consistency across the programmes. We've got quality indicators and metrics as one of our key lines of inquiry, and the Education Quality Assurance team are doing some work at the moment to look at how we can further enhance the quality assurance of NMC programmes. So these streams of work are going to very much going together hand in hand. I have to be honest and say it's not something that I had thought about, but it's really helpful to have it come up in the chat, in the Q&A, because we can think about how we can take it forward in relation to that. And that's really why it's so important that we get as many people as possible on the community of interest, so that when we go out, because part of our work will be going out and having sort of workshops or round tables to do some of this co-production with people, that we're able to get interested people from the different stakeholder groups involved and included in that. So I don't know that I've answered the question, but I'm glad it's on the table. I just wanted to come back to what Jackie was saying about if we and Suma about the work that we're doing at the moment. We're doing these key lines of inquiry to take recommendations to council in November. Those recommendations may include some activity to strengthen focused practice learning standards. It may not. It may be about the information and guidance that Suma's talked about. If the recommendation and council approves it, and we don't know what the recommendation is at this point, but if the recommendation is to make some focused changes to the practice learning standards, we will go out to a consultation sort of February, March time, and then go back to council sort of late spring, early summer, so that if there were any changes, they would be approved, ready for September 2026, and there would be that run-in time. So at the moment, we're doing all this work around the key lines of inquiry to identify what we take to council for recommendations. It's really helpful that you've asked that question about students not completing a programme. I mean, there are, we won't dwell on it now, but it's a really helpful question. Thank you.
We probably could have a whole webinar just on that particular topic. Just also, I will bring you in, Jackie, just bear with me. We have 5 minutes left, and just to assure everybody, all the questions will be very helpful for the work that we are doing, and particularly for the events that will be organising, the engagement events. So please feel free to continue to add your questions. They will not be lost in the ether. They are very helpful to us. Jackie, if I can bring you in.
I think as well, we mustn't forget that the universities themselves have their own regulations. So there is a sort of a balance, isn't there, between what our standards say as well as the university's regulations say around repetition of assessments and that type of thing. So that is sort of more locally led. I thought it was really interesting in the chat about the, the comments about the breaks and the hours and one thing and another. And I think we've already identified that a definition of what practice learning is and what a practice hour is probably something we want to try and aspire to. And there was also another one around practice assessors and practice supervisors about mandatory. Well, of course, within the standards, it talks about that all registrants would be to undertake those roles. And I think, interestingly, the other work that's been done in revalidation is also one to watch, because there's also some suggestions about how that will be incorporated. So I think I suppose what I'm saying is the role of the practice supervisor and the practice assessor is very much under discussion in terms of their responsibilities, how they verify that, etc. So really important to remind us of that.
Thanks, you, Julie. Jackie. I'm just conscious of the time and we have a poll to do. So for now, we're going to stop with the questions, but thank you so much for all the questions and comments. And as I've said, I want to reiterate again, we won't lose any of these comments and questions. Just putting the slide up as to how you can stay in touch with us. We'll also reshare the community of interest and how you can sign up for that. And Julie, I'll hand back to you.
Thank you. So just a couple of slides about how you can keep in touch with us. I hope it's been helpful. It's definitely been helpful for us. We're very grateful for all your questions, which, as Suma has said, we'll be able to keep track of. Just to let you know, next slide, please, Gurinder, we have some monthly drop-in sessions. They're available. Anything NMC, basically. But what we'd really like you to do as we draw to a close, and I know that people will be needing to go back to work or have some lunch or whatever, is if you could just take a couple of minutes to complete the poll, that would be incredibly helpful. Hopefully you're feeling more informed than when you started, but if you're not, then it's really important that we know in relation to that. We will be putting this webinar onto the NMC website. Do sign up for the community of interest. We also have a practice learning review email address, which you can use if you have any particular queries or concerns. Of course, it would be really good if I could share that with you. I think it really literally is practice learning review at NMC. Let me just check. Yeah, practice learning review. No commas, no full stops, no nothing, at nmc-uk.org in relation to that. To be honest, we've still got some questions as well as we go forward on this work. But thank you for joining us. Thank you for asking your questions. That will be really helpful. If we didn't get to it in this webinar, we will look at those questions anyway, and we'll be using them to update our FAQs on the website. So thank you very much for your time. That's brilliant. Nice to see you. Thank you.
Thank you. Bye.
Thanks, everyone. Bye.